Hi, my name is Lily Holland. I'm going to be doing a physical assessment video today. Before I go into any patient's room, I will always follow general principles and safety practices. Before I go into the room, I'll perform hand hygiene and don PPE if necessary. Hi, my name is Lily and I'll be your nurse today. Do you care if I do a physical assessment on you?
I don't care.
Okay, can you tell me your name and date of birth?
Jesse Williams, 5202.
Okay, and her identifiers match up. And just by looking at her, I can tell that she is clean and kept, she's not in any distress, and she's not short of breath. Are you experiencing any pain?
No.
How about any anxiety?
Nope.
Nope. Okay, so next I'm going to assess her symmetry. Do you care to hold out your arms for me? And your legs? Alright, symmetry looks good. And if you could just walk to the end of the room for me and back. Alright, her mobility looks good. And with her facial expressions, she has good facial expressions. She maintains good eye contact, and she is hygienic. Next, I'm going to go into vitals. I'm going to get her blood pressure first.
You want to do it a little tighter?
Yeah, I will. Alright, and I'm going to put my stethoscope on her brachial artery. Alright, her blood pressure was 120/80. Alright, and next I'm going to get her heart rate. Her heart rate is 62. Her temperature is 98.7. Her respirations are 16, and her oxygen is 100%. Next, I'm going to go into the head and neck portion of the assessment. Her head size and shape looks good. Her skull is intact. Her face, she's got no lesions. It's symmetrical. She doesn't have any facial hair, and her skin coloration looks good. Next, I will go into her ear assessment. Her ears are bilateral in shape and equal in size. And then I'm going to go to her ear. She's got no swelling, no redness, no edema, no lesions. And I'm going to take a look inside her ear. There's no discharge. She's got an adequate amount of earwax, and she does not have any foreign bodies like hearing aids or anything. And I would do the same to the other side as I did this side. Next, I'm going to assess her nose. She's got no drainage in her nose. Can you open your mouth for me? Okay, and her oral mucosis is wet. Next, I'm going to assess her swallowing. Alright, she swallows well, and she doesn't have any slurred speech. Next, I'm going to go to her upper extremities. Can I see your arm? She's got no swelling, she's got no redness, no edema, no skin breakdown. And I would do the same for the other arm. Next, I'm going to go to your lower extremities. She's got no swelling, no redness, no edema, no skin breakdown. And I would do that for the other leg, and then I'll go to her feet. Same again, she's got no swelling, no redness, no edema, no skin breakdown. And I'd be sure to make sure to check the heel of her foot on both feet for any skin breakdown. Next, I'm going to go to her chest. Her skin is intact, there's no breakdown, there's no swelling, no redness, no edema, and I'm going to do the skin turgor test. Alright, and she is well hydrated. Next, I'm going to go to her back. Skin is intact, no swelling, no redness, no edema, no breakdown. And also, I would assess her sacral area if she had a history of sacral breakdown, skin breakdown, or a history of immobility. So next, I'm just going to ask her a few questions. Are you taking any medications over the counter, supplements, or herbs?
Nope.
Do you have any allergies?
Nope.
Do you have any past medical history that I need to know about?
Nope.
Are you up to date on all your vaccines?
Yes.
Okay, a couple more questions. Are you financially stable?
Yes.
Do you feel like you have a good support system?
Yes.
Do you have transportation to and from doctor's offices and pharmacies?
Yes.
Okay, do you feel safe in your home environment?
Yes.
And what's your highest level of education?
A bachelor's degree.
Okay, so that concludes our physical assessment. before I leave the room, I would perform hand hygiene and I would doff PPE if necessary, and then I would report and record.